Hi, everybody. Thank you so much for joining me today and joining this DAP training series. This is the first in a series of month-long trainings. I hope you're signing up for as many as you can make. For folks who are longtime practitioners, you may recall that we did this series a year ago. The goal is really to teach you everything you need to know about SSI practice, from representing kids to representing at hearings to representing at the state disability level. This is the first training, so we're going to do a quick overview of how SSI works, what it is, like just some very basic rules, and then kind of run through the nuts and bolts of a case. It's 90 minutes. I don't know if, I'm sure many of folks on this call have done community ed via Zoom. It's really hard, especially because I can't see you all. And so, you know, I'll try to kind of manage time, but I'm really happy to get feedback on chat. Kelly's going to monitor it. For folks who have questions, or maybe I say something unclearly, or you feel like you need a little more information, please put your questions in the chat. I'm going to try to pause intermittently to skim the chat or have Kelly like read out questions so that we're making sure we're kind of keeping this as interactive as possible given this awkward format. So I'm going to share my screen real quick if you'll just bear with me, and we'll get started. Can you see? Hold on, sorry, having some technical difficulties. Kelly, can I just confirm you can or somebody who's not
Yes,
muted?
you're good.
You're good to go. Okay, great.
Yep.
So that was so nerve-wracking to not know. So just so folks know, sorry, I'm already failing at my Zooming. As I'm at CLS, I'm the managing attorney of our SSI practice there. Here's my email address. People should feel free to reach out to me with any questions, or if I can connect you to resources. And Kelly is going to send these slides out at the end of the training to everybody who registered. So please take them and share them and use them in whatever way is most helpful to you. So we're going to do two things. As I said, we're going to start with an overview, and then we're going to go through the anatomy of a case. For folks who are new to SSI practice, or maybe just dabble in SSI practice, or will be dabbling in SSI practice, let's just start really basic at what SSI even is. So SSI is created under the Federal Social Security Act. It's a federal program that is mostly, unlike a lot of welfare benefits that are federal, like SNAP, those are administered by the state. SSI is administered by the Federal Social Security Administration. So there are some differences in ways we can talk about later, but it's mostly a uniform national program. The part of Social Security that most people know about is what's called Title II, which is Title II of the Social Security Act. That's what people are referring to when they say Title II. And it's got a lot of different names. But it's OASDI, Old Age Survivors and Disability Benefits. So it's the benefits that most people think about where somebody has paid into the system through wages, through money taken out of paychecks. So same as you all who are getting paychecks. And that money kind of goes into the trust fund. And then when you retire, based on a complex formula of how much you paid in, you get a retirement benefit. If you have a disability, a qualifying disability before retirement age, you can collect benefits as an individual with disabilities. If you die, or if you otherwise become incapacitated, your survivors or your dependents can collect disability benefits as well on your case. So that's sort of the program that everybody thinks about when they think of Social Security. SSI is a separate program that's like a cousin to, regular Social Security benefits, and it's set up through Title 16 of the Social Security Act. So on a lot of the notices that you might get from Social Security, or just in kind of people speaking colloquially, when they say Title 16, what they're talking about is SSI. And you can get both. You can get Title 2 and Title 16 concurrent benefits in a way we'll talk about in a minute. That's sort of the jargon that some people kind of float around. We're not going to use that jargon here, but those are the terms that you may have heard. And you'll notice, so Social Security disability income is the Title II disability benefit. Supplemental security income, see they sound the same. And sorry, that should be Social Security disability insurance, excuse me. So that's a typo that I will fix. But they sound alike, right, in the initialisms, and that is intentional. The idea really is to sort of show, even though the words are different and even the eyes are different, which you can't tell from my slides, they're similar programs. And then the third benefit that is administered by SSA is the Medicare benefit. Different than Medicaid. Medicaid is the state benefit. You go to the welfare office. It's an income-based insurance program. Medicare is a benefit that goes to Title II recipients, retirement and disability recipients. We're not going to get into Medicare. I know there's probably some experts on this call, but that is a program that sort of filters in here and does not generally impact folks who get SSI unless they also get a concurrent Title II benefit. So who gets SSI? It's people who haven't had enough money come out of their their paychecks over the years to get a full Social Security benefit. So people with lifelong disabilities in a lot of cases, and also children, right? Children haven't paid into the system in a long way. Also, people get it, if your Social Security award, maybe you have paid into the system through paychecks over a period of time, but it's not that much money. It's not enough to kind of live on. You can debate whether SSI is enough to live on, but it's, you're getting maybe $400 benefit or $500 benefit. SSI comes in and sort of pluses you up to the SSI income limit plus $20. That's how that works. And so the way that you qualify is either you reach retirement age, which is slightly different. SSDI or Social Security benefits, the age is variable. With SSI, the retirement age is 65. That has not changed, even as the Social Security retirement age has moved around a little bit. Or you have a qualifying disability. And just to be really clear, the disability standard for Social Security disability and SSI is the same. It's the same set of rules. It's just that the money that you get and the law that you fall under might look a little bit different. So the kind of the categories of folks, the buckets of folks that qualify for SSI are people age 65 or older, as I said, people with serious and long-term disabilities, or children with severe and marked impairments. And the adult and the child standards are slightly different. There are some similarities and also some differences. I think I saw that Paige Martineau is on this call from North Penn Legal Services. She's going to be doing a training on children's disability benefits, children SSI. So just a preview and a plug for you to attend her session if you're interested in the children's eligibility piece. So the adult disability standard is, there's a lot going on in it, right? And just having a disability is not enough. And that is often very confusing and confusing in a way that makes SSI just feel very murky and hard to understand. And so our goal for today is to just spend as much time as we can in 90 minutes trying to demystify what the heck is going on with SSI and why people feel like it's so hard to get. So the definition for SSI is that you have to qualify, you have to have, and actually this is for the SSDI standard as well, for any disability standard for adults in the Social Security system, you have to have an inability to engage in substantial gainful activity because of mental or physical impairment that is expected to last 12 months or result in death. So there's a few pieces to unpack here, right? For those of us who have some legal training, paralegal training or law training, you kind of, that's part of what they teach you, right? Is how to like break down these definitions. And so we'll kind of break them down. The key components of this definition is, first of all, substantial gainful activity, an inability to engage. And that really means inability to engage in full-time work. And that is defined like a lot of things in Social Security part of why I think people find Social Security so confusing is it is a totally made up system. And we're going to talk about that a bunch in the next hour or so. But it's a system that is really set up to have these like proxy definitions so that like full-time work doesn't actually mean full-time work. And we'll talk about that soon. But it's just like Social Security's definition of like, can you work enough being sort of this like made up construct. And you'll see what I mean as we keep going. And then the second piece of this is mental or physical impairment. And so the idea is that you have to have an impairment, it has to be diagnosis. We'll talk about that too in just a minute. But you know, it can't just be sort of like a general, like, you know, you've got kind of stuff going on and maybe like you're having a hard time. There has to be like a true diagnosed condition. And by true, like that sounds like a value judgment, but it's like on paper, like value diagnosis. And then the big piece that we get a lot of questions on, I bet you all do as well, is 12 months or longer or death. So unfortunately for a lot of folks who need safety net benefits, you know, Pennsylvania does not have a robust safety net for people who need shorter term benefits, especially since the general assistance program, cash assistance program went away. But we, you know, if folks, we get calls from people who have, you know, construction illnesses or like car accidents or things like that, and they're going to be out of work for a while, and they don't have a disability benefit, they don't qualify for workers' comp, maybe they really need several months of income to kind of get through until they heal enough to be able to work in some way. And this Social Security is not that benefit. That is not something that is available for people under those circumstances, unfortunately, because there is this durational requirement. It has to be a long-term condition. And so being in traction, breaking both arms, and having kind of an expectation that you're going to be fine in like 10 months is like devastating, right? And people have a really hard time paying bills, and how the heck are you going to like pay your rent? Our safety net is unfortunately just not equipped to resolve that issue in ways that are really like devastating for people and really like upsetting when you're getting these calls. But SSI is just not going to be available to somebody under those conditions. And so that is that durational piece is really key for a lot of the kind of questions that you might see on intake or from people who are struggling and need help qualifying for benefits. Every year, the income limit goes up a little bit. It just went up, what month are we in? February, it just went up last month. It's right now it's $794, which is, not the poverty line, right? It's not this, no one is getting rich. No one is living, you know, an extravagant life on SSI. It's a really low benefit. And I don't want to diminish its value and its importance for our clients, because as we just said, the rest of our social safety net is even worse. But this is not a benefit that like people quit their jobs because they're going to make so much money on SSI, right? Like this is a benefit that it is no one is living their best possible life with $794 a month. If you're married to somebody, your income limit, even, you know, and you have a married couple, both people are receiving SSI, there's actually even a penalty for that, and you can only get $1,191. If, as I said, you're a concurrent recipient, you get SSI and SSDI both, maybe you get like $500 in SSI or SSDI. The SSI, you get an extra $20, as I mentioned. So you would get an $814 benefit for those folks. The state, every state or most states have what's called a supplemental payment, where the state gives a little bit of money for cost of living. In this case, it's in Pennsylvania, it's $22 for an individual. And so the average person who gets a full SSI grant, which is not everybody, most like the average benefit is like $590 because of overpayments or maybe other income in the house. If someone is getting their full grant, they're getting $816.10. The SSP, just to say this, it comes from the state. It can be very confusing for people because it comes in the same mechanism that the regular SSI check comes. So, you know, if you get your SSI check on a direct deposit debit card, or if you get it deposited into a credit union bank account, if that's how you get your check, your SSP goes in that same payment source. And so people sometimes get confused because $22, it's like, you know, you don't always notice it because you're like money in, money out, right? And so we do occasionally see issues where people's SSP gets messed up, where like there's some data exchange issue from like Social Security to the welfare office, or PADHS. And you know, I know there's people on the call too, like Jacob, Eden, and some other folks who have like pretty solid non-disability practices. Those are cases that we have folks at CLS who kind of have fixers, and I think, you know, are happy to share those contacts. But I will say that sometimes when we ask clients about SSP, or maybe they say, I'm supposed to be getting this $22, often, not always, but often they're getting it and it just hasn't quite registered because it does sort of come on that same check, that same payment method on the same day, on the 1st of the month. Just to flag, there is an asset limit. We are starting to see some people who are having asset problems because their economic impact payments or their stimulus payments are being counted. Those payments, just to flag while I'm like running through this stuff, those payments are actually being exempted. So that's something to fuss at. So at Social Security offices, if your clients are running into asset issues and the problem is that they have stimulus money that maybe they're saving or they're holding on to for a particular expense that they're anticipating. So the anatomy of a case really quickly, because I think it's just helpful to know like how people are like interacting with the Social Security offices. And for people who maybe did SSI cases 10 years ago, but haven't thought about it since, or for people who, the system has changed a little bit recently. So just to kind of say that explicitly as well. So our clients mostly interact with the Social Security offices in their local Social Security offices. Most of those are closed except for emergency circumstances. So a lot of people are applying online. I know that some of you all help people with applications, but in a non-pandemic environment, right? People are walking into Social Security, filling out applications there, and that's sort of their interface or their experience with the Social Security world. Once you apply for Social Security benefits, your case gets sent to your state disability office. And it's weird, right? Because I just said Social Security is a national program, it's not a state program. Every state has an organization called a DDS, a Disability Determination Service. And it's a state agency that contracts with Social Security. Social Security sets the rules, Social Security pays for it, but it's run by state government. And it's run by state government not because of any like high, like important like efficiency reason. It's run by the state government, both so that the federal government can say, oh, like we're nimble, we're small, and because state salaries are lower than federal salaries. So there's no like lofty reason to do it this way. Social Security is just trying to save money and not get like beaten up by Congress for like being bloated. And so in Pennsylvania, our DDS, our Disability Determination Service, is called BDD, the Bureau of Disability Determination. And this is massively confusing for people, right? Like they get mail from this place called, they go to Social Security, they apply for benefits, and then they start getting mail from BDD, which is part of Pennsylvania's Department of Labor and Industry. That's like just how it's organized. Even though it like works with Social Security, it like exists physically, like building, like everything sort of lives with the Bureau of Disability Determination. And so that's where the mail goes. And then that's how the case is, that's who's like looking at the case and comparing any medical records, any information that the client's provided with like the disability standards that we're going to talk about. And then a decision gets rendered, and if somebody gets approved, that's fantastic. About what, like 40% of people get approved, maybe sometimes a little less. And then if they, so that's level, I think maybe a third, I'm sorry, like I know Sarah Lynch is on here and she knows, and I usually know too, but for some reason it's like straight out of my brain. I think about a third of people get put on at the first application. And then they appeal, and it used to be you would appeal and you got to go immediately to a judge because Pennsylvania had a special set of rules around efficiency. The Trump administration decided that they wanted uniformity. They wanted to make every state the same. And rather than get rid of this like appeal process for everybody, they made Pennsylvania start to have to do a second appeal. So starting in April 2019, which when people get turned down by BDD the first time, they have to file an appeal and the case goes back to BDD. And then it gets looked at a second time. And like, I would love to tell you that that looks like some sort of like adjudicative process or some sort of like close read and like really people are really looking for errors. What really happens is like it goes from like Terry and cubicle 1 over to Steve and cubicle 2, and Steve like looks at a case again and like does the exact same thing. And you know, he's looking for errors, but only about it depends. I mean, our stats are a little murky because this is a pretty new process. Between 10 and 20% of people get approved there, of the people who appeal. And then if you get turned down, then you appeal again, and your case then goes to the hearing office, the Office of Hearing Operations. And so I feel like from this, like just a couple take homes. First of all, this is kind of a dumb, sorry, I'm trying to say dumb less, a silly system. It doesn't make a lot of sense. The idea is to create a lot of hassle, frankly, and like have a lot of people get annoyed and quit the system so that Social Security has to do less work. That's like explicitly like why we added why the Trump administration required Pennsylvania to add this new appeals process, because it will cut down on hearings before judges because people will just give up. But it's a very silly process. It takes a lot of time. 40 to 45% of people win on their hearings. And so the incentives in this process are really messed up, because you have a really good chance of getting turned down when you apply. And then you have a really good chance of getting turned down and you appeal. And then you have a pretty good chance of winning your hearing if you go to a judge. And at CLS, I'm sure, and I think a lot of the programs, I've talked to other planned programs about this, like I think we win like 60% of our hearings. Our win rate is really good. And so if people can hold on, and sometimes this process takes years, they can get benefits, right? Like they can qualify, but there's so many steps and so many roadblocks. And so I'm sure that you hear this when you talk to your clients, or if you haven't represented clients in this area yet, and maybe you will, like just as a person in the world, right? Like you hear how frustrating it is. And it's just, I would love to have some sort of like pep talk about this. I think the pep talk is that you all matter, like you doing this work is so important, but that frustration is really valid because this system is intentionally set up to make people give up and go away. And so it's just enormously, enormously helpful that you're doing this work. It's something that I'm just like so evangelical about. So a couple of quick things, and then I'm going to pause and take questions. You have to review, once you get on, you're not on for life, right? Like you're on an SSI recipient forever and ever, unfortunately. If you get on for disability, you have to have a continuing disability review. In general, people reviewed about once every 3 years. If you're older or you have a certain condition that's like very unlikely to improve, maybe you get reviewed as infrequently as every 7 years. But most people do have to have these like periodic reviews of their cases. Some people are reviewed in a year, right? People who have transplants, children who are born premature, there's a 1 year renew pay. So this process starts all over again in a very stressful way for lots of folks. And when you go to that second stage, if you get denied or if you get like found to have be medically improved, at this case review, at this red, and I'm like, I don't know if you can see I don't think you can see my cursor, we're in this red thing where it says reconsideration, Bureau of Disability Determination. There's actually like a mini informal hearing for people who do welfare cases, like county assistance office cases. It kind of looks like those hearings. You know, it's not necessarily with a lawyer, they're pretty informal. It's like a conversation. And then you kind of go to this full hearing with a judge if it comes to that. Children also have to be reevaluated when they reach age 18. They go from being evaluated from the children's standard, which, as you might imagine, does not include a work requirement, right? Like you're not looking at whether you can work. But as you become 18, judges are looking, or the adjudicators, the people at BDD, they're looking at whether your condition precludes work. And so it's a different legal standard. And so your case is reevaluated and lots and lots. I think 75% of kids do lose benefits at that stage because, you know, the work test is actually a really hard test to meet. If you get denied, this is sort of like the big thing to take away from all of this. If this is not your area, you can get statutory benefit continuations. People call it SBC, some of us call it continuing benefits. You have to appeal within 15 days. But in the pandemic, you know, Social Security, to its credit, is doing a lot of work to be very flexible with these appeals deadlines. And so if people need benefits continuation, but they've missed the 15 deadline, maybe the mail is delayed, they didn't know how to file an appeal, they couldn't get into the office, they couldn't reach you in time, there is an opportunity to request good cause for a missed appeals deadline, or like for, you know, not appealing within the 15 days. Just like there's an opportunity to ask for good cause for missing any appeal deadline right now. And so I'm sure there's a lot of people on this call who are doing this already. If not, to really make a pledge, we're doing a lot of this work too, is like because there is a lot of flexibility, but you have to ask. Unfortunately, Social Security isn't giving it automatically. Really want to urge people to be very liberal in asking for good cause and for really making sure that people get the benefits they need because of the mail issues, because they can't walk into benefits, because the internet is spotty, all of those reasons, because it's hard to reach us, because a lot of us are working remotely or maybe have limited intake situations. Super, super important that we're like really making sure that we're helping people get good cause for missed appeals, because we can kind of help overcome all of that with some good advocacy. I'm going to pause and look at any questions that we might have, and also, you know, if anything has come up or any questions have arisen, please put them in and we'll try to run through a few of them before we move on to the disability standard.
Kristen, so this is Kelly. We don't currently have any questions.
Oh, yay. And then I saw, I'm sorry, is this Sarah that wrote me? Oh, yay. Okay. All right, awesome. I'm just like making sure seeing what I missed. Thank you, Sarah. I needed those stats that I meant to brush up on. So thanks. All right. So let's sorry, I'm just like checking one more thing. Oh, smiley face. Okay, thanks, Sarah. So sequential evaluation. Sorry, let me just back up real quick. So sequential evaluation is like many things in Social Security, right? It's one of those terms that sounds super confusing. Like I feel like we've just created this like weird language and mythology around SSI cases. And whenever I talk to people who don't practice in this area, and I will say my first 10 years, I did state benefits cases at CLS, and I was like, oh, I don't want to touch SSI. SSI is hard and confusing. I don't understand what the heck is going on, and nobody gets benefits. It's not really that hard. It's just that we use this like really confusing terminology with all these big words. It doesn't make any sense. It's all made up. And if you kind of bring that lens, like I'm going to use a bunch of big words, this is a totally made up system that makes no sense, it's actually not that hard, right? It can even be like a little bit fun because you're like, oh, I can like work within the system. I can give people money and who really need it. But you have to kind of take that mindset, because otherwise it's just really frustrating and confusing. So sequential evaluation is really just this like weird set of terms that basically says you have to go through 5 steps in order to qualify for SSI. There's like no test on what these are. I will tell you that this like little chart, I made this for the last DAP training, and the little arrows, it's like my pride and joy. So you all can just enjoy that and know that I don't know if I will ever be able to make this again. So just feel a moment of accomplishment here. But it really is like yes or no questions. And this is like where we're going. And I'm going to tell you where the action is. The action really is step 3 and step 5. Everything else we'll just talk about really quickly. But when you are lawyering or advocating on a case, you're really interacting with the client a little bit at step 3 and a lot at step 5. That's where all the work is. We're going to spend a little more time on step 3 today because we have really excellent trainers. We have Jane Allen, who did some training last time and is awesome and is going to lead a kind of an overview of step 4 and step 5. in a couple weeks. And then we're going to be doing tons of like breakout, like we have a whole week on this stuff. So today I'm just going to kind of run through and like give you like a framework and a background, but then we're going to have lots of opportunity to practice and develop competency as we go. So the first test is you'd be like, oh, the first question is obviously about disability. It's totally not. It's going back, hearkening back to what I said about 20 minutes ago about substantial gainful activity, this weird like made up test. Are you engaged in substantial gainful activity? I'm going to tell you the number in a minute. There's just a number. Like, are you earning $1,310? It changes a little bit every month. And if the answer, and that's gross, not net. If the answer is yes, you have more than 1310 gross, you don't get benefits. Period. The end. It doesn't matter if it's 1315 and you're close. It's 1310, game over. You don't get benefits. Remember how we said this is like a totally made up standard? It's a totally made up standard. Like that doesn't actually correlate to hours or anything. It's just the number that Social Security has set on, and that's the world we live in. It's kind of, you're starting to see, I bet, like this is why it's just a made up system. Then the second piece is, does the claimant have a severe impairment? And this goes back to that piece around physical or mental impairment, right? Is there something in their medical records that is a diagnosis? And if the answer is yes, then you proceed. If they don't have a formal medical diagnosis of anything that is severe, and severe is like a term of art, right? Like there's kind of a sense of what severe means and definitions. If there's a severe impairment, then you move on. Most legal services clients are going to be just fine on step 1 and step 2. There are very few cases, like when people are coming in for intake or you're assessing a case, not a whole lot's going on at step 1 and step 2. Where a big piece of the action is does the claimant have an impairment that meets or equals a listing? And we're going to talk about that in a second, because I was super afraid of the listings. They're not that scary, but we're going to kind of go through what that means. If they meet the listing, they win. If they don't meet the listing, their case is not over. But so this is like the first place where you can win your case and be done. So some people, not very many, but some people are just fine at step 3 and never have to go any further. At step 4, we ask if they can't meet a listing, if they can't win their case there, can the claimant return to past relevant work? Some of us have clients who have past relevant work, and I know different legal services programs have different criteria based on what other attorneys in your area, like I know in some parts of the state, you might not have other attorneys who are taking like cases. And so you can take cases with people with work history. Some of us, I know to other parts of the state, like in Philly where I practice, we have lots and lots of people who will represent recent workers, because there's different fee incentives for people who have more work history, who are in like the SSDI world. And so we tend to only represent people without very much work history. So this tends to not really be an issue for us. There might be some more action here, and Jane is going to talk about that at her session in a couple weeks. And then, can the claimant do work that exists in significant numbers in the national economy? That's where like most of the cases get won. You want to show that somebody cannot do any work, and then you win. That's the process. So this is the sequential evaluation. I'm going to run through it in a little more detail, but this is sort of the steps, and what that means in practical terms we're going to tell you, because it's there's more mystique in, with my beautiful arrows than really exists, right? Like there's just a couple places where you're really doing the work. So, as I mentioned, substantial gainful activity is the level of work that a person can do. Just to reiterate, totally made up. Sometimes people want to argue about this. It's like, that doesn't make any sense. It totally doesn't make any sense. But the rule is 1310 in or out, gross. You look at their monthly income. If they're over 1310, game over. But I will say, harkening back to something I just said, the goal is to show that somebody can't do work. And so if they are earning $1,290 a month, even if they're working like 30 hours a week or 25 hours a week, this is not a great case. And your supervisors or the folks that you work with in your programs are probably not going to take this case, and I'll just like encourage you to think really hard about whether you want to put your very limited legal services resources into this case, because your case isn't going to get knocked out at step 1 because you're not over 1310. It's a very bright line rule, but you're going to have to like make the case to Social Security that $20 is really the difference between working and not working, and ability to work and not inability to work. And it's really hard. You're gonna have a really hard time at step 5, which, just to remind you, at like, can you work? Is the benefit, is there work in the economy that you can do? If you're working 25 hours a week, you're making $12.90 a month. This is maybe not the best case for you to put limited legal services resources. But if you are at $12.90, Social Security is going to move your case along. You're not going to get rejected at step 1 of your case. Step 2 is whether there's a severe impairment. We already talked about this. I'm not going to belabor it. But the things I just want you to know is that Social Security has preferred providers acceptable medical sources, another term of art. Social Security loves term of art. And there's just a set of people that can give you a diagnosis for that count for step 2. And those include, like, you need a licensed physician, a physician assistant, not a therapist, not a psychotherapist. And so the key piece here is that like basically somebody with like prescriptive authority, or like provide, like, maybe a Medicaid provider, somebody who's like, who is deemed by Social Security to have medical training. So that is one barrier with behavioral health conditions. Many accredited behavioral health providers are really good about making sure that the diagnoses come from like psychiatrists, that they're the ones who are signing off on intakes and evaluations, but that does sometimes become an issue. Teachers, or people, a lot of school personnel that are not school psychologists are fine, but like, people who are not sort of in a formal medical role cannot, like, having medical records from like a teacher that says, Stephen has ADHD is not sufficient. This comes up a lot in kids' cases, less so in adult cases, but just to kind of flag that that's an issue. And another issue is often competing diagnoses, especially in a behavioral health condition, because there's often not a lot of agreement about what's going on. And so, trying to kind of hone in on like what the impairment is, and like with conflicting evidence, can be really tough. I'm not going to get into this stuff in any great detail. I feel like this is like when you like phone a friend, when you like reach out to somebody, a more experienced practitioner in your office, where you like reach out to somebody at CLS if you want. We are happy to be resources. There are just some cases that are really hard because they are mushy, and Social Security rules are really like either overtly unhelpful or not helpful, possibly unhelpful. Those cases include obesity, fibromyalgia, drug and alcohol, what they call drug addiction and alcoholism, DAA, which is very like somewhat antiquated, substance use disorder, chronic pain, and then those issues without a secondary impairment or another severe impairment are a lift, because Social Security has bad or unhelpful guidance. And so those cases, if you decide you want to take them, I just want to flag for you, those are the kinds of cases where you would talk to a supervisor or an experienced practitioner in your office about the merits of moving forward with a case like that. The other cases that are really hard, and I kind of alluded to this a minute ago, is like rule out diagnosis. And we see these a lot in the behavioral health context, right? Like rule out major depressive disorder, rule out PTSD, where it's like, there's like an inkling, and Social Security doesn't really know what they mean. And so they sort of take that to mean like, oh, it's not really a diagnosis. And so that's where like, there's a little bit of action around like this step 2. For the most part, a lot of this screening is done at your case acceptance stage. And I know you all have systems, even if maybe you're new to this practice, maybe you haven't fully, embedded yourself in those systems yet. Most of this work is going to be done before you get the case. Sometimes though, you may think that there are diagnoses, and then you're like, holy crap, there's like nothing on this case. Like, I don't have any medical records that say this person has a diagnosis. That's when you would maybe start hard conversation with your supervisor, and then think about how you want to proceed with the client, and have a hard conversation with the client about the merits of their case and the success and what they might need to do. But this is really what happens at step 2. Not a lot of action, like for all the words that I'm saying, I'm just sort of flagging some trouble spots, but your lawyering or your advocacy is not going to really exist here. Where you're going to spend some time is on step 3 with the listings. And I'm sure there's a lot of people on this call who have heard about the listings. I was afraid of the listings before I started doing SSI work a few years ago. They're not really that scary, and they're Googleable. I feel like anything that you can Google is less scary. So, there's a hyperlink here. You'll get the slides, they'll be hyperlinked, but you can also just Google SSI or Social Security listings. You can do it now if you want, and the split screen. And it's just basically an index of diagnoses. And there's 14 categories in various categories. And so if you have, what you are looking for is the list of standards, or basically the list of criteria that somebody needs to meet. And what you're doing is you're matching the medical records that you have. And Becky Dempsey from Mid-Penn is going to do this awesome training on Thursday, make a little plug for her, on developing a case and your ethical obligations and how you do it and the nuts and bolts. That's where a lot of the work is, right? Is getting your hands on those medical records and how to do it. And we're going to have this big conversation, 2 hours of ethics credit, should you need incentive. And so if you'll join us, then that's really what we're going to talk about. But I'm just going to assume you have your medical records and that you're following Becky's wisdom. And so, you're spending time in your medical records, sort of looking up these diagnoses that you have identified as part of your step 2 analysis. And then you are seeing if you can, because this is where you can win a case, see if you can meet any of the criteria. The physical health listings are pretty technical, and I will say can be somewhat hard, right? Because there's pretty clear medical jargon, and you're trying to compare CT scans, or you're comparing with like medical jargon. This is, we spend a lot of time on Google, right? And we just sort of try to figure out how close can we get? Can we say they meet or equal? Equal a listing means we get really close. Maybe it's not exactly right, but we're within the range. We're doing some of that lawyering. But if you are a legal services lawyer, a lot of your work is in the mental health realm, right? I'm sure a lot of you take behavioral health cases. That is certainly at CLS our priority, because our private bar counterparts in Philadelphia really like physical health cases, because again, it's pretty straightforward, right? As long as you can Google some medical terms, you can figure out yes or no. Mental health cases are a little bit murkier, and we're going to kind of run through why that is. But this is where you're doing your work. And so in the behavioral health context, there's this listing of impairments, this set of categories, and there's what's called within them and the A criteria, the B criteria, and the C criteria. And to win a behavioral health case at step 3, you have to meet the A criteria and either the B criteria or the C criteria. And so you are using these medical records that Becky has, transporting ourselves in the future. Becky has taught us how to do that 2 days from now. And we are using those records to meet that criteria. And so here we go. So I'm going to talk about the trauma listing, because the trauma listing is, sorry, a little cameo from my younger daughter. The trauma listing is somewhat new. I think that Social Security is not really excellent about applying it. And lots and lots of our clients have trauma from their communities, or from family circumstances, or from other experiences that they've had. And so we'll use that as an example. And if you were to Google it, this is what would come up. This is, word for word what it is. So the step A is that you need medical documentation of all of the following. And then it kind of runs through these 5 criteria. And for those of you who know a little more about the medical world than maybe me or maybe others on this call, These are the DSM-5 criteria. This is the DSM definition of trauma. You have to show exposure to actual violence, subsequent re-experiencing, flashbacks on nightmares count, and that's what a lot of what we see when we take these cases. Some sort of pattern of avoidance, disturbance of mood or behavior, so like an effect on how you interact with the world as a result, and increases in arousal and reactivity. So like startling, the nightmares are great. Nightmares are, SSI is a messed up world, right? Because we're like, yes, nightmares. Very awful for our clients, really heartbreaking, and very good for your case because you meet both the re-experiencing and exaggerated startle response or sleep disturbance. So that's what you're looking for in order to meet the A criteria. Sorry, I just want to like make sure I'm like remembering my slides. Okay, so the thing about the A criteria is that it says medical documentation of all of the following. I just want to like harken back to you to the step 2 piece here, where we talked about medically determinable impairments. And that medical term is doing a lot of work, if you'll recall, because it's a licensed physician, licensed physician's assistant. That is, you know, psychiatrist. That is what is medical, a medical source. And so the reason I'm belaboring this is because looking at the A criteria, you'll note that the first word here is medical, right? Medical documentation. And so why am I saying this over and over again? The reason I'm saying this over and over again is because what you are doing to actual advocate in this case is that you are going through the medical records that Becky has taught you how to get, and you are looking for medical evidence. You are looking for records from a psychiatrist, from another medical provider, somebody with a medical license, physician assistant counts, who is categorizing this. And so that is not easy. Like, you know, spoiler alert, it's because most of the records in a behavioral health case that you are going to get are going to be therapy records. Maybe they're going to be from the school teacher. You're going to get a school teacher questionnaire. Maybe you're going to get stuff from testimony from family members. None of that helps you to meet the A criteria. What that does, all that does, you need the medical stuff. You need a doctor to somehow document all 5 of these in order to meet the A criteria. I am sort of belaboring this because I just want to make it clear, like, if you can't win here, you can't win here, right? Like, you can't make your medical records say something better than what they say. And so, you know, you have to have a little bit of like, the A criteria, you're kind of keeping it moving, but you're also doing an assessment, like, is it worth spending some time and really pushing that my client wins at step 3, meets or equals a listing? Because do I have medical evidence, you know, stuff from a doctor in the record that is going to get me to 1, 2, 3, 4, 5? That's like the lens that you're bringing to this practice, and you have to be very clear-eyed about it. You can't, right? Like, we, as much as we want our cases to be better than they are, we can't like will that into being. And so, you know, as you get faster, you're looking through the records real fast. You're spending 15 minutes and like just skimming. Can I get here? Can I do a 12-15 case? If not, all is not lost. We're going to talk about it. You can spend a whole week on what we do with Jane and with the rest of the training team. But that's what you're doing with step 3, part 1. And then we're gonna go to
Kristen, I'm sorry. Yeah. If I could just interrupt here, I need to launch the first of the CLE.
Oh, sure. Oh, sorry.
So, that's okay. Attorneys, if you can respond, I've launched it now. Just hit yes or no and it'll disappear from your screen, and I will leave it up for 2 minutes. Okay, thanks, Kristen.
Okay, thanks. All right. I can see the poll, Kelly, but I can't click on it, but I'm just going to assume you have me covered. And we can discuss afterward. All right. So after you get to step A, you're not done, unfortunately. at step 3. Step B, the B criteria, and I'll just say to just kind of go back, if you have a good case on these cases, the way you know you have a good case is you have a good intake or a good reeval. Most behavioral health providers do intakes and reevaluations every year that are signed by psychiatrists. And that's what you're really looking for, right? Like you're looking for an intake that sort of does a medical history. Maybe they have behavioral health hospitalizations at a behavioral health hospital or at a general admit hospital that has a behavioral health unit that has a full psych eval. That's what you're looking for if you're going to do this work. So just to say that really explicitly. And then you're going to go to, then if you can get there, and maybe you can't, and if you can't get there, you just kind of keep it moving, right? Like this is not the case. Maybe there's a different listing you can argue. Maybe you're just not going to win on a listing. And the way that I do that, we do like pre-hearing like statements to the judge, and we're going to be talking about those over the course of the month. And then I think maybe in some lunch and learns, we will just say, oh, listing 1215 is implicated, right? Like that's a very Weasley word. That's like, I want you to know that this person has trauma, but I don't actually have medical records. So we're just going to like flag this for the judge that this is an issue. And then we're going to make all of our argument at step 5. But if you can if you can get the A criteria and you've done your 15 minutes of analysis and looked at the psych evals and are like, yeah, 1, 2, 3, 4, 5, I am good to go. Then you're going to go to the B criteria. And the B criteria is where the work is, because there is no medical evidence requirement, right? That's where you're pulling in therapy records, you're pulling in school records, you're pulling in source statements from the teachers. That's where you're like doing the work to develop the case. That's where your client's testimony becomes really important, or maybe a family member testimony or case manager testimony. This is what you're doing. And you need to show that the client has an issue in generally, I'll say more about this in a second, 2 of these areas. And so you need to show that not only do they have, 1, 2, 3, 4, 5 meet all of the DSM criteria as summarized by a medical provider, but that in 2 of these areas, they have some serious challenges or some serious complications. Understanding, remembering, and applying information, that's really like how they learn, how their memory works. Interacting with others is interpersonal relationships, but family relationships, interactions with authority figures, interactions with the public, concentrating, persisting, and maintaining pace. That's their attentional stuff. Like how can they pay attention? How can they focus? And then adapting and managing oneself. So that can be a lot of different things, including activities of daily living. Are they able to keep the house clean? Are they able to, take showers? Are they able to dress themselves? Are they able to maintain basic hygiene? Are they able to cook for themselves? Are they able to, but also like emotional regulation, right? Like, can they regulate their emotions? Can they not kind of fly off the handle? And a lot of stuff in the records is going to fit in both areas. If people have outbursts, uncontrolled outbursts, that goes to interacting with others, but it also goes to emotional regulation, right? Adapting and managing oneself. If somebody isn't allowed to use the stove because every time they use the stove, they cause a fire because they get so distracted, that's both concentrating, persisting, and maintaining pace, but it's also adapting and managing oneself, right? Because it's an activity of daily living. If they don't know how to use money, right? And we have a lot of clients who don't know how to use money. It's understanding, remembering, and applying information. It's also adapting and managing themselves, right? So there's no, it's a very fluid, and it's, if you like these if you like this kind of advocacy, it's kind of fun, right? Like you're really kind of helping to build a story or tell a story about your client and fitting it into these very artificial slots. But that's both the work that you're doing in analyzing your medical evidence or your non-medical evidence and building a body of evidence in a way that Becky's going to talk about. It's also the client interview, right? The questions. And that's, I think, in some ways, both a really interesting part. It creates a lot of intimacy and a lot of trust, and you can really, we get very close to our clients in ways that is very meaningful. But you have to, it's also kind of hard to figure out how to get at some of these things. And there are just some questions over my years of practice that I have, you kind of learn by trial and error. like maybe for those of you who are not in areas with public transportation, this is less of an issue, but I was surprised when I started practicing how many of our clients have had altercations and have had bans or been put off of buses. I have been surprised. I was surprised, although, and now I know to ask, how many of our clients have gotten into fights at the county assistant's office waiting in line. Lots and lots of our clients have auditory and visual hallucinations and may not think to say anything about them because if they're so common, they've had them their whole lives. And so there just starts to become a body of questions that you ask and a way to build a case. And you're really trying to just show that, like, at the end of the day, sorry, I'm going to skip ahead, that like there is a marked limitation, which is sort of seriously limited. You know, this is the definition. You have to show a marked limitation where their functioning is severely limited. So very circular, right? You're sort of showing that like it's just like things aren't going great in these areas. You can win on the B criteria if you have 2 areas that are marked, one that is extreme. So if you have one extreme, and you can see what's an extreme, not able to function at all. And some judges will never find an extreme limitation. So in general, in these cases, we're making sure we can meet the A criteria, and then we're really working at 2 areas, right? Like one area is generally not enough, even if you have all of that medical evidence for the A criteria. So this is what you're doing in step 3 of your case, and this is a lot of work, right? Like, but this is the bulk of the case that you are building. If you cannot meet the B criteria, you may, in the alternative, meet the C criteria. Not a lot of cases meet the C criteria. So just to, you know, kind of belabor this, most of the work that you are doing is at step A, is at the A and B criteria. Sometimes, not often, sometimes you can meet the C criteria. And basically what you are showing in these cases is marginal adjustment. Like maybe somebody's like doing okay-ish, but they're doing okay because they have a very structured environment. And if they were to leave that structured environment, they would decompensate. So the reason you're kind of dealing with C is you can't maybe get 2 areas in B, or maybe certainly not 1 area at B. But you wanna, but it's only because like maybe they never leave the house, right? Like, so they have severe agoraphobia and all of everything they do is in the house, and they have a history of decompensation, but now they're doing okay because they never go anywhere, right? That's what you're kind of looking for at the C criteria is, you know, and sometimes case manager, you know, with people who are like in therapy like twice a day, and we want a case of the C criteria because, you know, we're like, this is how my client is managing to kind of function. Is he has a case manager who goes everywhere with him, and he does like 4 hours of therapy a day. And that's kind of what you're looking for to see. It's a little bit mushier, but the idea is really like, you know, maybe like you're not getting thrown off the bus, or maybe you're not having auditory hallucinations, or maybe you're not like, you know, lighting your food on fire by accident. But that's because there's a structured set of circumstances that are very specific to you in a way that would like maybe not be something that would be accessible to somebody in the work world, right? Like that's sort of the story that you're telling at step C. But just to say that one more time, A and B is what you're doing. Not that many cases. That was a lot of explanation. And the reason I did a lot of explanation here was because, as I said, we're going to be doing a whole week at step 5, although I'm going to start talking about it in just a minute. But not a lot of cases are one here. It's hard, right? Like just the A stuff is really hard, as we talked about, if you don't have those perfect psychiatrist records. And then if you don't have like perfect, you know, therapy records, like maybe the therapist is great for your client, but really bad at writing things down. Not a lot of cases get 1 because there's just a lot of boxes to check in a behavioral health case. But that's the lawyering that you are doing in order to try to win here. And if you can do it, if you can show that they meet all of the DSM criteria at A and that they have 2 areas 2 functional limitations at, or 2 limitations at B, your case is over. You don't have to go, you don't have to deal with the work world in any way. You just kind of get the check mark, your client gets paid, everybody kind of gets to move on in a very happy way. So that is step 3. And I'm going to pause for just a moment before I do steps 4 and 5 and just see any questions that might have arisen. Doesn't look like there are, Kelly. Am I missing anything?
Nope, no questions yet.
Okay, great. I'm going to take this as like my extreme clarity and not that everybody's like playing for yourself. All right, so steps 4 and 5. So let's say you just can't do it, right? You don't have enough medical records. You you thought it was a better case. You thought that they were going to a good therapist. Hey, their therapist is just not the greatest. Then the vast majority of cases adult cases get 1 at step 4 and 5, which is the ability to work. And just as a reminder, you're looking at whether they can return to past relevant work, so work with substantial gainful activity within the last 15 years. That's what you're looking for step 4. So if they had a job 30 years ago, does not matter. We're only looking at the last 15 years, and it has to be SGA, right? So you're looking at like, it's not quite 1310, right? Because it goes up every year, but like if they worked 2 years ago, but they only worked like 6 hours, that's not SGA, right? That's substantial gainful activity because it was $600, and $600 doesn't meet this totally arbitrary threshold set by Social Security. Just to say this really quickly, the way that you do this, and I bet Jane will talk about this a little bit, is that there's, you'll get the client's medical records through ERE, which Becky's going to talk about. You've got all this learning to come. And you're going to look at there's earnings reports in their Social Security record, and you're going to look at that and see, is there anything that gets close to $1,100, $1,200 from the last 15 years? And that's what the judge is going to ask about too, right? Like the judge is going to look at that and ask your client, hey, like I see that in like 2007, you had this job and you were making like $1,200 a month. Let's talk about it. If you are outside of that realm, if like they were making $600 in 2004 or making $600 even in like 2012, the judge isn't going to ask about it. They may ask about it because they just want to know, like, hey, like, what's your work history? Are you ever able to work? But let's talk about what happened, because that isn't information that is relevant to like their ability to work maybe in the future. But there is no step 4 issue, because step 4 is only your ability to return to past relevant work that is substantial gainful activity in the last 15 years. Step 5 is, there's a lot of factors, a lot of stuff going on. Jane is going to do a lot of training about this because it's a little complicated, but it's not hard. It's just there's a lot of like things that go into step 4 and step 5. But we're looking at your age, your education, your work experience, and then another like made up term, residual functional capacity, which is like basically like your ability to engage at work, your ability, like once we take your disabilities into account or your impairments into account, what are you able to do? Formal definition, the most a person can do despite their physical or mental limitations. Physical health cases, we're looking at exertional limitations. And again, Jane is, I got to see Jane's training last year. She's going to be really great about this. This is how long can you walk? How long can you sit? How long can you lift? How long can you carry? If you've sat in on client interviews in an SSI case, even if you haven't done them yourself, this is kind of what you're thinking about. What most people think about is like, you're kind of getting at like, how long can you, how many blocks can you walk? How long can you stand up before you take a rest? Because there are jobs that have classifications based on how many hours a day somebody is able to walk, how many hours a day somebody has to lift, somebody has to pick up a box that weighs 20 pounds. There are certain job classifications, and your ability to do that work is based on whether you can show. And so you're developing your case, right? Like client testimony, if you can't, can you pick up a gallon of milk? When you pick up a gallon of milk, how long can you carry it? Can you carry it in from the car? Do you ever get a case of water? Can you carry that? How many times can you pick that up, do you think, if you had to do that? These are the kinds of questions that you're asking when you're dealing with exertional or physical limitations is like helping to kind of show, and you know, the goal is to sort of show that somebody can't do jobs because they can't carry enough, or they can't lift enough, or they can't, you know, sit, or they're only able to sit for 2 hours and then they have to lay down because their back hurts. This is the work of the exertional limitations at step 4 and 5. That's part of your case. And again, just previewing that Jane is going to go into great detail. So if you're like, I want to know more about that, please attend her session. The other thing that you do with RFC includes non-exertional limitations, which I know that Jane is going to talk about this as well. I'm just going to kind of run through it as well briefly, because I know she's got a lot to cover, and we're kind of in that behavioral health world of this training. There is a ruling. So a lot of Social Security rules, a lot of the Social Security work that you are going to be doing, and I recall, I think Becky's going to talk about some of this, it doesn't really live, like you're not reading like statutes really, like that's not the language that you're speaking to the judge. A lot of the work that you're doing are in Social Security rulings. I think Becky does go into this in some depth. I know she's going to talk about like some of the case development ones, and then I think Jane's going to go into some of the ones, and I think Paige is going to go into some of the ones around child. So you're going to get the full gamut of some of these. But there are these rulings that sort of tell judges and tell disability examiners at BDD and tell us as advocates, like, how do you move forward in a case? And for non-exertional cases, the standard is such: unskilled work requires a sustained ability to understand, carry out, and remember simple instructions, respond appropriately to supervision, coworkers, and work situations, and deal with changes in routine work setting. Substantial loss of ability in any of these areas, so not all of them, any of them should result in a finding of disability. And that language exists at this ruling, which is hyperlinked and also cited below. And that is sort of your magic language. If you have a behavioral health case, you might win it at a listing, and it's great to spend a little bit of time figuring that out. And, you know, I spent a lot of time talking about it, but you're going to go through it pretty quickly as you get to be fast at your lawyering, or your advocating if you aren't a lawyer. But the bulk of your cases that you're going to win are going to be here. And what you are doing is pulling through medical evidence and testimony. It doesn't have to be medical, actually, it can be non-medical. And you are showing that based on these experiences, these conversations with your therapist, these psych evals, these histories, these school histories, you have issues understanding instructions. You have issues carrying out instructions. You have issues remembering instructions. You have issues with supervisors or authority figures. You have issues getting along with other people. You have issues with like routine work situations, or like situations where there might be like a little bit of stress. Situations where like you have to deal with changes. Like you're, you know, kind of, you know, we talked about this at the B criteria, right? And like you're sort of pulling out, it's a little mushy, but it's like a little bit of a puzzle to try to fit medical evidence into these areas. You're doing the exact same thing here. And this is a good place to put your time, because this is where the work is, right? Like this is where you're going to win your case. And so we're going to spend a bunch of time with Jane kind of walking through this in much more detail, but this is how you are using your time, and how you are anticipating that you are going to win your case, and how you're like sort of, you know, conversing with the judge, right? Because we do have this like very like artificial work lens applied over the disability world for lots of reasons that are very frustrating from a justice standpoint. And so you're taking people's like lived experiences and people's history in ways that are not maybe for people who haven't worked, and you're putting them into work language, because that's the language that Social Security decision makers speak. After you sort of make your case, right, and you're going to build your body of evidence, and you're going to make your argument, and if you're in a hearing, there is an expert that comes in based on everything that you have said and your client have said and any other witnesses have said. And that person is called a vocational expert. And this is the part of the Social Security cases that everybody is afraid of. And that's why we're spending a whole week on step 4 and 5. These vocational experts sort of take the testimony that they have just heard and that the judge has just heard, and the judge builds a hypothetical based on the testimony. Assume a person who cannot get along with coworkers. That's a great one, because you have to be able to get along with coworkers to work. Remember, like, substantial loss in any of these areas means you win your case. And so the judge is going to ask a hypothetical about whether you, with a same person with your age, education level, past work experience, and physical and mental limitations, can perform past relevant work. If they can't perform past relevant work, can they perform any work? So that's step 4, any work, or past work. Any work is step 5. And so that's what's happening in your case. And then you, as an advocate, get to ask alternative hypotheticals based on the claimant's record, if the judge got it wrong. Sometimes you've done such a good job laying a foundation for your case that the judge asks this question and then say no jobs, and then you shut up and you're like, oh, I'm in, the end. That's the end of the case. But sometimes you have to ask questions based on the foundation that you have laid. And you're basically like, okay, well, assume somebody who cannot, let's say, who cannot deal with routine changes in a routine work setting, and you are, because from SSR 8515 that if you can't deal with the changes in a work setting, then there's a result in a finding of disability. And then the VE then says no jobs, so they can't do any jobs, and then you win. So that's sort of your goal, right? Is to make it so that the judge has to either creates a hypothetical that gets the VE to say no jobs, or to make it so that the judge has to accept your hypothetical, which says no jobs. That sounds more confusing than it is. And so that's just a little preview. I don't want to stress anybody out. This is a preview of what we're going to be doing later this month, because that's where a lot of like the stress is. It's not, I'll just say this, we're going to spend a bunch of time on it because we want everybody to get really comfortable. What you're really doing is you are laying, like, those of you who've had trial advocacy or have seen trials, seen Law and Order, right? You're creating a foundation, because you are asked, that's why you're eliciting testimony from your clients. That's why maybe you're writing a little mini brief to the judge summarizing the medical records. You are laying a foundation and really making your case that somebody can't remember simple instructions, or maybe somebody can't deal with supervision, or maybe they can't adjust to routine changes in work setting, so that you can ask that hypothetical and get that has like foundation, right? Like that's the whole point. And so rather than sort of stress too much about how to cross-examine a vocational expert, because there's so many great people in this training team that are going to teach you that, I'll just say, like, that's sort of your goal, right? You're trying to get as many facts into evidence because you are putting in the time to make your job easier for the judge, to get the judge to agree with you that a person can't work based on this ruling. And this ruling is really your guideline. Like that's the universe in which you're dealing with. Let me just looking at this real quick. We talked about this. I just jumped ahead. I sort of told you all this. I'm just going to say that there is a thing called the grids. The grids is like a framework. It's exertional only, so it's based on your physical health problems, your age, your education, your work history. Oh, I forgot to take this out. It used to include ability to communicate in English. It no longer does. This is an old PowerPoint that I updated, but I missed one. If somebody has exertional limitations, there's some ways using the grids to automatically win, and I'll have to get into this world of like dealing with vocational experts and cross-examining. So it's always nice to have shortcuts. Still in this step 5 realm, and I will just make another plug for Jane, who is a great trainer on this stuff. So we can look forward to that in a couple weeks. I feel like the hard part about going first and doing this is like I probably am leaving you with more anxiety and stress about step 5 than I intend, but hopefully I've also sold you fully on staying with us so that we can answer all of the questions that may have popped up. And then I'm just going to pause for 1 second and see. Oh, I see. Jane's talking about, mystery person's talking about how great Jane is, who's going to do amazing things. No pressure, Jane. You know, you're only, we know you've got it in you because many of us got to see it. So I got to hype you hard because I've seen the training in action before. So my question about is not clear. Under step 3, is part B always part of the analysis? So that is really great. So the answer is no, but usually. So just to remind you, you don't need step 3 to win. You can win at step 4 and 5. You can win at step 5. So that's just one reminder. You can just ignore, if your client doesn't meet step 3, your client doesn't meet step 3. This is not intended to be a source of stress. Judges generally do not let clients win at step 3. So just to say that as a reminder. For step 3, though, if you are able, you know, and you start with this with the A criteria and you go through like, you know, what my medical records say, then your choice is either part B, step B, or step B, part B or part C, Melissa. So you go to B is most people are going to meet, if they're going to meet the step, if they're going to win at step 3, they're going to meet the B criteria. They're going to have 2 areas of limitation, but step C is an alternative option for them. If they cannot meet the B criteria, but they do meet the C criteria, you can win using A and C instead of using A and B. But you have to meet A no matter what. And again, all is not lost. A is a quick and easy way to knock out your case for a handful of people. Most people, just because of crappy medical records, because our clients have crappy records, are like, you know, not always getting the best possible treatment, or maybe not able to get all the treatment they need. Most of our clients just do not have a body of evidence, even if we know from talking with them that they should win at step 3, most of our clients just do not have the body of evidence to get them over the hump at step 3. And that's where step 5 and this like focus on work and that 85-15, if it's a behavioral health case, becomes really important, because that's really the language that you're engaging in, because there isn't that same medical evidence requirement that you're dealing with at step 3. Next, okay, go ahead, Kelly.
If I can just launch the last of the CLE polls, that way we have time for questions to continue. Attorneys, please respond to the poll that's on your screen now, and I will leave it up for about 2 minutes. Thank you.
Thanks, Kelly. Sorry, one more question. When evaluating an appeal for reconsideration, will the BDD look at new events evidence or only what was available at the time of application? That's a great question. And while I'm plugging, you know, I shouted out Sarah earlier for the statistics. Sarah Lynch is going to be doing a training toward the end on BDD advocacy and reconsideration advocacy. So another set of trainings to plug. So up until you're hearing with the judge, you could improve your case at any point, right? So so every stage is considered de novo. It's reconsideration, so it sounds like, oh, that should be like we all were, you know, maybe the case, maybe it's just a review of the previous decision. But if you accept a case at reconsideration, and we represent at recon, I know a lot of other practices are doing a lot of recon cases. If you take a case at recon, you can absolutely submit new evidence. You can do little mini briefs. You can do all kinds of information that might help improve the case. And then same at a hearing, right? When you go to the hearing, you're continuing to develop the record. You can, you know, even present a new theory of the case if the client's diagnosis has, you know, maybe they had one diagnosis from a previous provider that wasn't a great fit. Maybe that's why the case was so hard. Maybe they have a new diagnosis that's appropriate. It can become a totally different case, and you are sort of just sort of deepening the judge's understanding and submitting new records and getting new evidence in ways that Becky's going to talk about when she talks about developing the record. Once we're going to do, not in this series, but I believe in March, we're going to do something on appeals counsel. And once you lose, if you lose, hopefully never lose, but if you lose at a hearing, and you go to an appeal at the appeals council, which is the next stage of appeal, and then onto federal court, that is not there. You can't provide new evidence at that point in general. Like in general, they're looking at, it's a review of whether the judge followed the law, the ALJ followed the law. And so that's where things stop. And we're going to do sort of like a 102 round of trainings starting like monthly, starting in March on AC, appeals counsel practice. Any final questions before we wrap up? All right. Thank you all so much for joining me. This is, oh, wait, sorry, one more thing, I apologize. Is there a statutorily defined time for how long an initial application remains open before a decision? No. Unfortunately, there is not. So for non-disability cases, there's a statutory requirement that appeals have to be adjudicated within 90 days. There are some guidelines and some BDD, DDSs, and others sometimes get dinged for not handling cases timely. But right now, cases with the pandemic and with like applications are way down, people are not filing appeals on all their cases, maybe they don't want to have a hearing, cases are moving really fast. So for those of you who have a history of doing these cases, maybe stepped away but are coming back to them, we had this period where you could kind of, somebody would appeal, or maybe like a case would sit for a minute. They're not sitting, right? Like things are moving. And so there's a little bit of a practice challenge for all of us right now. And I think that's why part of what we're looking forward to having this conversation over the coming months, because judges, you know, OHOs, hearing offices are scheduling at one point, you know, folks who've done this work for a while may remember hearings are being scheduled like 2.5 years down the road. Hearings are being scheduled like within a matter of months, because so many hearings are on hold because of people want to participate telephonically or don't want to participate telephonically. And so things are like really flying. And so as you're thinking about accepting cases, you know, there was a period where we could think about taking cases and we're like, okay, we'll take a few months and we'll like get some medical records and we'll sort of start moving. And in order to really like practice ethically, you have to kind of be prepared to just fly on the case. And so that's sort of something to factor as you start thinking about getting involved on these cases. I want to just be mindful and like, at least I feel like we have so much to talk about, and we're going to have so much more content. So I want to stop this one on time so that you feel very, very respected and ready to join us next week on Thursday. And one more plug for Becky's session, which was really phenomenal last year. She's a really outstanding trainer. So I'll be there, and I hope to see a lot of you there. So thank you, and thank you. I'll just say this, sorry, as we're wrapping up. Little pep talk. These cases are sometimes hard and they're stressful and they feel complicated. You're like changing people's lives. With this money is like, this is the safety net we have. And so I just really, really appreciate everybody being here and kind of going down this road, because people really need you. So thank you so much. And I will look forward to seeing you on Thursday.
Thanks, Kristen, so much for being here and presenting for us today. And everybody have a good rest of the day. We'll see you Thursday.